So I'd like to recognize that in the spirit of our journey to promote reconciliation, we would like to honor the truth of the shared history and acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. And we are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. And I'd like to acknowledge that I am speaking to you from Treaty 6, Métis Region number 4 here in Edmonton. So perhaps Marlene and I are going to do this presentation today. My name is Ann Smith and I'm a consultant for Healthy Aging Alberta and was involved in the facilitation related to this project. And now I'd ask Marlene to introduce herself to you.
Yeah, I'm good afternoon. I'm one of those RSV survivors, I think. I'm really pleased to be here. I'm a retired healthcare and education leader living in Airdrie. I am on the board of the Alberta Association of Gerontology and chair of the Futures Policy Forum Initiative and the Culture Change Project, and co-led this project with Anne.
So today our purpose is really to share the results of the project, and we're going to do that at a fairly high level. It is an overview, and we have quite a few people joining us today. So my hope is that today we will whet your appetite, and you'll see later in the presentation, we'll ask for some of your interests so that we could dig deeper later on as the opportunities present themselves. But what we'd like to do, as I said, is share the results of the project. We have a poll or two where we're going to ask you for your particular interest. And if time allows, potentially using the chat, then we'll begin to share other collaborative activity. Because I think one of the things we've learned from this project is that this is a dynamic conversation around community development, collaboration, and integration. And it didn't begin with the project, and it certainly doesn't end with the project. So what we're going to do today is I'm going to speak briefly to the methodology and purpose of the project. And then Marlene is going to share the mental model and ecosystem that were developed. So we created a frame for the conversation. And then we're going to share the call for action that is at the heart of the project. So that in essence is the core of what we're going to do today. If you are just joining us, if you would introduce yourself on the chat with your name and your organization, that would be great. But I'll touch now briefly on our methodology. So the purpose of our project really was to look at whether or not there was alignment and application for the healthy aging framework for community-based cross-sector collaboration. And we were really interested in whether the framework might provide a shared mental model, might support us to develop common language, might support understanding of new delivery and service approaches, and would help us identify shared income in impacts and outcomes. So we are really interested in whether the healthy aging framework, and I will describe that later on in the presentation, provided us that common ground that we could begin to rally and talk about our work. And we developed 4 phases for the project, which was undertaken between March to August, and it was quite iterative. So the idea was that we would start to pull the thread, and then we would keep building out on ideas so we could get to our call to action. So the first thing we did was we held 8 virtual conversations where we were really just trying to explore what is the application or possibility of the healthy aging framework. Do we see some possibilities for it as a focal point for helping us to undertake our collaborative and integrative work? Then from those initial conversations, we called it the digging deeper phase. We began then to say, we'll look at some of the ideas that are emerging or some of the work that's being done in community. Let's understand it in greater detail. Let's see if we can build upon it. What might it suggest we need in terms of further action? So this digging deeper phase was done really between May and August. We held a workshop. We called it the application workshop, of which 35 people attended. And again, we kept pulling on, here are the ideas for action. Here is what people are saying we can build upon. What do you think? Are these the opportunities where we can build on the framework and build on the collaborative and community-based activity in the community? And then lastly, we were very fortunate to have a group of approximately 15 strategic contributors. So those were individuals with expertise about older adults who have leadership roles in government or community, and who supported us to say, the directions we're taking, the ideas that are emerging as we form this call for action, which is at the heart of the report and at the heart of our intention. Does it make sense to you? Can you validate it? Can you help us refine it? So in essence, we use those four steps to determine, was there a shared mental model that we could look at for our collaborative work? Does the Healthy Aging Framework help us? And what might a call for action look like to advance the work that is well underway? That would be one of the conclusions, I think, of this work, that to advance the work that's well underway in terms of community-based collaboration, particularly looking at health, housing, and the community-based senior serving sector. So I'm going to turn it over now to Marlene, who's going to share with you the shared mental model and ecosystem that are at the heart of this report.
So the next slide, the North Star, where are we headed? We have a great opportunity in Alberta. Alberta's vision for system transformation for healthy aging and quality of life for older adults with a sustainable and resilient health system. How does that sound as the North Star for all of us working on that? That actually was first set out in April 21 with the Myers-Norton-Penny report. That report talks about facility-based continued care. It's a part of it. But the first part is actually envisioning a different system. And this is the vision that is there. Most recently, in November of the past year, we have the plans for restructuring Alberta's healthcare system. This vision isn't expressed in the same way, but that restructuring plan calls on us to improve outcomes for people across the lifespan. It calls on us to connect differently, connect together, including with not just health and housing and continuing care and mental health, but also with the seniors portfolio, because that North Star is as important in April 21 as it is in November 23, and it is today, February 24. And I invite you to think about everything we're going to speak about as helping you think, aha, I've got an idea to move there. And the first piece, if we're going to move to that North Star out of our work, it was very clear we had to share a mental model. Because if we're all over here, as we typically have been, I'm over here in this kind of organization and you're over there. We don't sometimes even understand what we each do. We have to come together with the outcome of a shared mental model. And the result of our work is person and community-centric ecosystem of community-based services. Some of you come from those. Housing, some of you from them. Continuing care, AHS services, with a shared intention. That ecosystem includes us all, and we challenge a shared intention on well-being, living well. So if that's our mental model toward our North Star, the question is, how are we going to move there? And that's where we have two calls to action. One focused on processes and practices, and we're going to go through those. There's some immediate opportunities and some take longer. And then we have some structural system policies and new system designs that we also have to pay attention to move there. Now, of course, when we did this report, we did not know about the restructuring for the Alberta health system. We believe now this has even more value to be a foundation for success with that. Next slide. So when we talk about an ecosystem of health and social supports focused on well-being. We're talking about, think about your community. We're talking about a base of living in community with well-being and minimal care needs. And you can see a number of the services that would be so important. We're talking about services in your community that actually support well-being when people have moderate to complex care needs and they're living in housing options and being served with a number of services, either funded or in the community or voluntary. And then we may be living well with complex care needs in care homes, an ecosystem that includes us all. In the past, we've had, oh, those primary care people, they're over here. Well, now they're one of the pillars. So is mental health, so is continuing care, so is AHS. So we have the partners in care, primary health care, and they've been working on a health home. The challenge will be, it's not just about a health home, it's about the integration. Technology is a major piece of knitting together my linkages with providers, with my family, and each other. And when we do begin to make the best use of all that we contribute for well-being, we actually are really enablers for the best use of emergency care and ambulatory care and treatment. So that is thinking broadly, valuing completely the opportunities for service in a community. The next slide takes our mental model to the next place. And it says, how actually will we make it work? And it has in the center, person, population focused. Think about your community. I live in Airdrie, 80,000 people made up of such and such and such. Maybe for First Nations, you're focusing on First Nations globally, and you're thinking about the range of different people in different communities for the First Nation. Or maybe I didn't see, maybe you're in Rocky Mountain House. Who lives there? What are those people? What, how many? But more importantly, the second ring, what do we know about them? Social determinants of health. That was a big contribution of the Healthy Aging Framework because it's common language. We're thinking about older persons, we're thinking about determinants of health, and when we all look at them together, understand from people's perspectives, understand from the data that we can get, we begin to see how we might say, aha, this is important. This is really important. And we can look at the ecosystem around us, the one we just said, and say, what are we doing well right now? Where are the gaps? And how might we improve that toward outcomes of well-being? And then finally, how do we put the supports underneath for well-being and mobilize community action that knit together in a sustainable way with resources for ongoing support of family, friends, neighbors, and community resources working to those ends? That is our final mental model of putting the pieces together. And we'll go to the next slide where Anne's now going to talk about what are some of the ways we're already working to connect the dots and build, in this case, the first one on the Healthy Aging Framework. And you're on mute.
You would think after all this time, I would remember to take the mute off. I think there's two key assumptions that we really want to focus on as we talk about this project. And our assumptions were that community-based action and the community-based senior serving sector are essential to serving older adults and supporting their well-being. And the second is that we really do need to see integration and collaboration across sectors. So given what Marlene framed in terms of our vision and our outcome, we thought, can we use the Healthy Aging Framework? And I'll explain it in a moment. Can we use this framework to support us to have a starting point for conversation, a way of organizing our thinking and ideas so So this framework was developed for the community-based senior serving sector. It's based on a piece of research that was done for the Association of Senior Centers in 2018. And really, we believe, and I think it's been proven true, that although it was done for centers, it has great application, not only in the community-based senior sector, but in other sectors. And this project, I think, has helped reaffirm that assumption, that this framework has a lot of resonance for people, regardless of the sector that they're working in. But what its primary purpose is a framework that helps us articulate and organize the work of organizations that are serving older adults and to support them to age well in their home. And I think it's important as we look at the screen to see that the framework has 5 building blocks. These are truly building blocks. They can be used, adapted in any way that makes sense for the person or organization that's using them. So as Marlene mentioned, the framework is grounded in the determinants of healthy aging. So if you reflect back to the slide before this, that's the first inner blue band. Right after we had those seniors centered in the middle, we had these 6 determinants of healthy aging, all that are required to support our well-being as we age. Then the second building block is what we have called service responses. Think of these as bundles of service. So there are 23 of them. For example, there is a home supports bundle of service. There is a physical health bundle of service. So rather than talking about programs in detail, we can begin to come together to say, we have common interest, we're all focused on home supports, or we have common interest, we're all focused on mental health. So it helps us identify areas of service. Then, of course, we do have activities, which are those program service areas. For those programs and service areas, we have particular outcomes. And those outcomes in this framework focus on the outcomes we anticipate will occur for the older adult, but also there are some outcomes that we hope to achieve for systems or process, such as increased access or improved navigation. And last but not least, and often this is the starting point for how we use the framework, is impact. There are 12 impact statements, and those are the longer term change we would expect to see if we are able to assess strengths and needs for older adults, create effective service response and activity, and achieve outcomes we have designed over time. So this is the Healthy Aging Framework, and the premise of the study was to say, does this framework help us begin to have meaningful conversation as we look at community-based cross-sector collaboration? And I think the answer to that question is definitely yes. That is a conclusion that we have seen from the study. One thing, though, we did ask when we did those first steps, the initial request for conversation is this activity something we have to start, or is it something that's well underway? And I can't think of the image to try to describe this, but resoundingly, this activity is underway. So in the report, and I want to do that now if we move to the next slide, there were 2 broad-based initiatives that were really identified as other frameworks that would be highly supportive of cross-sector collaboration and community, and that are being used extensively. So if we could move to the next slide. I'd like just to acknowledge that the Connecting People and Community for Living Well initiative, which is designed to build and support, it's looking at collective well-being. This is a key initiative where there were lots of connections and parallels drawn between it and the Healthy Aging Framework. So we really wanted to acknowledge that this initiative that is undertaken by Alberta Health Services was identified as a significant resource tool and action that will support that vision statement and outcome that Marlene has so effectively identified for us. So I know this, by being an overview, I think we're maybe just teasing you a bit with identifying some key tools and resources and then continuing to discuss the project outcome. But this is well underway and has funding in place to 2026, so pretty critical. And you'll see that linking connecting people and community for living well and the healthy aging framework is an action we've identified so that people involved in both those initiatives begin to integrate these resources and tools to support communities to use them as makes sense to them. And I would just want to flag the next critical piece that people identified very consistently as needing attention, or that we should pay attention to. And if we can move to the next slide, is all the age-friendly activity that is undertaken in Alberta. So people in our workshops and in our work really identified that age-friendly communities, again, are on the front lines of looking at cross-sector collaboration to advance the outcome of the health and well-being. So those age-friendly communities are promoting healthy and active aging through a wide variety of activity. So again, the feedback we got from people was that both connecting people and communities for living well and age-friendly should also be included as sort of central tools or resources, just like the Healthy Aging Framework, to support the work that we're trying to advance through the call to action. So I'm going to turn it over now to Marlene, who's going to begin to share with us how we frame the call for action.
Right. Well, I'm hoping you're beginning to see that this graphic with people and population in the center is at the core, and beginning to see the linkages with the determinants of health from the Healthy Aging Framework around. When we think about our intentions for well-being for older adults, the thoughtfulness about the determinants of health and the age-friendly community, you could see it all around. It all comes together in shaping the actions we take to understand the needs of people and populations, however they are best defined and most relevant, for the needs and the priorities, and then connecting the many supports that maybe we haven't seen as much before in our community ecosystem, but they are there, and inviting them into the conversation to understand together with the people who live there what it takes for well-being. So now we will go to the call for action. That's great to scheme away, but we have to do some things to make it happen. And we ended up with 5 areas as a call to action. The first one, we need to build common and plain language. Otherwise, how can we learn and talk with each other? There were 3 major areas: going from seniors to older adults. That's respecting the individual and actually getting out of language that might link to benefit entitlement to more about the people and where they are at in relation to being older adults. Determinants of health, as we understand, and Healthy Aging Framework is giving us some buckets that are helpful, and we can use that language. And that was particularly exciting to the Stakeholder Collaborative Committee of individuals from a range of organizations. They could see this applying. They could see that being useful. And then the other concept was well-being. Well-being belongs to all of us. Sometimes health thinks, that's the Department of Health. No. Well-being is the sum total of what we all contribute. So number 1, build common and plain language. Number 2, identify, integrate, and connect aligned resources across sectors. That's now thinking broadly about our ecosystem, the community-based health, continuing care, housing, etc., and mobilize collaboration, intentional collaboration there. And number three, draw on that ecosystem that we are now beginning to understand and value, and the framework to look at shared intentions. What do we understand being important to the people in that population of interest, and how can we mobilize, build on what's there, add what's not there, and really focus on some shared outcomes for well-being, system impact, empowered workforce, etc., and the experience. But we also heard loud and clear we have to support those three areas, one with improving navigation and assessment tools for older adults, caregivers, and providers, because we might know about you, but how do we actually connect? And then advocate to remove barriers, including funding, and evolve policy and system design so we can actually work together in new ways. Those are the buckets of our calls to action. And Anne will now speak to those.
If we could move to the next slide. Again, I think one of the important things for the project, another perhaps result that I would highlight would be the way that people helped us organize the ideas. We had so many ideas for action, and then to think about how do we begin to make sense of these action areas so that we can describe them and people hopefully can begin to take hold of them. So as Marlene said at the beginning, we looked at practice and process change. So focusing primarily on what was happening in community related to direct delivery. And then we saw that in this area, there were some things that were well underway, and we could either build upon them, support them, promote them, try to advance them. So there were things that we could put our hands around right this moment and probably achieve a result in a fairly short period of time. Then in that second band of longer term development, yes, we could start now, but there was probably going to be need for discussion and development, but still very action oriented. From the beginning of this project, we wanted the call to action to be the primary result, that we didn't want to just have an agreement in principle that cross-sector activity was important, or the community development and action from the ground up was what we needed. We really wanted to highlight how can we build upon what's happening and have a call to action. So that practice process change and those two sort of nuances about things that we could really take hold of right this second and things that needed longer term development. You'll see that in the action area. And then, because we had very wide-ranging conversation, some in those conversations said, well, you know, action and service for older adults is not enough. What we need is structural change. So you'll see in the action plan, there is a structural change component. And we looked at it because it's a bold action plan, not only in terms of some of the policy, systemic policy that needs to change, but also some identified that systems design was necessary, redesign was necessary. As they looked at that ecosystem that Marlene presented to you, that we really do have to change up how we have designed some of our systems and processes to better serve the older adult population and support their well-being. So I'm going to be very bold now and in quick order try to give you a flavor for the call to action. And I'm going to focus, if we could move to the next slide, I'm going to focus on those immediate opportunities, but you'll see for every opportunity area, or in my world, I might call them strategic direction, that has been identified in the call for action, I recorded and captured the ideas that were brought forward under each category. So when we look at building common and plain language, many saw this opportunity as a very foundational starting point, that this was absolutely necessary if we're going to be able to work together. So in terms of those immediate opportunities, people saw that common definition and common language was really something that we could do now, and we should begin to identify some key terminology and develop common definitions for conversation. And I think Marlene highlighted that we could use the term older adult, perhaps not use the term senior. We could use well-being, perhaps, rather than healthy aging. So some conversation about what words would really help us to have common understanding, and that we could use the healthy aging framework with those 5 building blocks to really begin to develop a way of having meaningful conversation about the determinants of social health, the impacts we're looking for, the program areas we're acting in, and the outcomes and intentions we're looking for. So that was really something people felt we could get our hands around very quickly. Then people did identify that in terms of a developmental piece, we could keep building out the healthy aging framework in terms of people's understanding, but also refining it and improving it as we learn. But that was seen as a longer term activity. But again, a lot of support for saying we need a way of making sense of our world and our action, our collaborative intention, and the healthy framework is helping us do that. In terms of systems policy, and you'll see this comes up more than once, lots of people identified that although we're trying to support older adults, using age-based eligibility criteria is a systems policy many ask that be challenged, that really we should look at the strengths and needs of people and respond programmatically to those needs rather than having an age criteria that prevented many who might need a service or support or have a contribution to make from participating. So building common and plain language was a place where the healthy aging framework and also connecting people and communities for living well were really seen as key tools that would help us to do this work. So I'm going to move to the next slide. So this is a huge area of activity. The second opportunity that was identified, which was identify, integrate, and connect aligned resources across sectors. I think it's a very, very positive result from the project is this work that I think all identify as so very important in terms of community-based action and integrating action across sectors is really, really well underway. And our challenge is to keep track of it, connect it, organize it, share it, use it. So you will see that in this part of the action plan, some very specific tools and resources were identified. And we know that this is not the whole picture, that there's a number of other actions and activities that are going on in community that we haven't captured. But this is what came forth from the discussions of this project. So the work is well underway, but in terms of an immediate opportunity, I've just lost the slides. There we go. In terms of an immediate opportunity, no one heard panic in my voice? No. In terms of immediate opportunity, it is to coordinate the use of the healthy aging framework and connecting people and communities for living well. So that when someone who, for example, the community developers who are involved in Healthy Aging Alberta and the community resources associated with the Connecting People Initiative work in community, they can present both sets of resources to community groups and members and support them to use both resources so that we begin to coordinate activities, support communities to understand the supports and resources that are available, but always using them as makes sense for them. Through the application workshop in particular, people engaged in the project became very aware of the social prescribing initiatives across the province and the Healthy Aging Asset Index that's been developed and is being promoted by the Northern Alberta Regional Centre on Aging. So both those are very clearly identified as things that we should really promote and make sure people in community know about and can access and use. Not the only ones, because there's lots of models for non-medical support, but they were flagged. And then again, because age friendly was identified, and also Alberta Health Services Aging Together, again, two very concrete initiatives that we should begin to work together at in terms of making sure people are aware of them and can use them. So as we look at the longer term activities, it really is to just keep on building out that integration and connection. So again, using what we are learning and understanding to build out the healthy aging framework, to develop our understanding of the ecosystem and how we connect. You'll see that the idea of using the healthy aging framework as a catalyst, let's use this as a starting point to help people see how activity is integrated and connected. And then particularly for people from rural perspectives, they really identified the importance of FCSS and municipalities and the work that they do, and that these are two key organizations, agencies for connection. And then because we had some very ambitious people involved in the project, they said, and after we helped connect housing, health, and community-based senior serving organizations or sector, let's not stop there. Let's look at other sectors that need to be connected and integrated into this work. So you'll see that in this case, there wasn't systems redesign action identified. So in the third area, this was oops, that's the second one still. So outcomes and evaluation was a theme that was developed or discussed broadly in the project. And I think as it's fair to say that really thinking about where was there sort of some common intention, it was around the frameworks to develop shared intention. So while our specifics may be different, but surely we can begin to identify common impact, common outcomes. So you'll see that people are very well aware, we're very well aware of some of the initiatives that Healthy Aging Alberta is undertaking with respect to home supports, transportation, and social prescription. And they said it's great that the Healthy Aging framework is being used to support that work. So let's keep going. Then the second area is really action area is really saying, well, let's keep identifying action that's out there and how those actions are connected, particularly profiling exemplars or best practice, some might say, and looking at what are the outcomes that they are striving for, how are they achieving them. So really looking at what we can see and pushing ourselves, I think, to develop new exemplars to support the work that we think is important. So those were the immediate opportunities. And then you'll see in the longer term opportunity, there are some specifics. I think as all of us know, there's a lot of framework and activity out there around intention. So let's try to align some of the key concepts that exist. And the recovery-oriented systems of care was identified as one key area where there is lots of good thinking about intention and outcome, and some of the work done by family and community support services. So again, trying to build on the activity that already exists, but begin to identify common ground and use it with intention. So you'll see then with the second area was it's connected to other work, but if we're going to use the healthy aging framework as a catalyst for action, let's use it also as a catalyst for talking about shared intention and outcome. And then the last area under longer term opportunities was some sense that we need to do some deeper thinking around vulnerable and marginalized populations and try to identify what is needed there, what's our intention, do we have shared outcomes, and what services and supports are needed. So those are the longer term opportunities that have been developed. And then in terms of systems policy, the color, the diagram that Marlene has shared with seniors at the center, really, if that is our vision for what we want, then let's begin to look at what is needed in terms of programs and services. And again, lots of feedback in this report, not to use age as the criteria for access, but to use either the strength we're trying to act upon or the need we're trying to respond to. So our fourth area is navigation, improved navigation and assessment tools for older adults, caregivers, and providers. Navigation was a really important issue to many involved in this project. And I think many people saw that the Healthy Aging Framework had potential to be a bit flipped on its side. It was designed primarily for service providers, but many said, well, why can't we use the Healthy Aging Framework to help individuals understand the range of services and supports available to them and what outcomes they might expect? So that's where this theme or opportunity area was identified. In terms of immediate action, a lot of passion around improving the number of community connector roles, so formal and informal, who provide support to individuals. So health navigators, link workers would be examples of some of those. So we need more of those relation-based resources to support navigation. So let's advocate for it. People may not be aware of the Healthy Aging Asset Index, but as I mentioned, it's been developed by the Northern Alberta Regional Centre on Aging, and it is a very strength-based approach to assessing the needs of older adults as they age. There's, I think, people who saw this heard the presentation and the application workshop, thought this is something we really have to get the word out about, so let's promote it. And again, the third area, and I know much work is underway in this area, is really to recognize and support the family caregiver. So those were identified as the three immediate areas that should be pursued related to navigation. Then I think in terms of longer opportunities, and you can see here where some of the opportunities and themes cross over, was we have a lot of information sources out there, 211, 811, the CS, the assessment that caregivers have developed. Let's try and align those and develop common language so that we can support people to understand well the resources that exist there. You'll see again, thinking that navigation should be integrated into community-based activities. So let's not make it distinct or separate from that. And then, as I mentioned, really to look at self-assessment tools for navigation by older adults. So really trying to build out those connections. And there's some work underway with Alberta Blue Cross, and the sense was, again, that there was great potential for collaboration, and Healthy Aging and Blue Cross have definitely developed a relationship around common understanding of navigation and support. And again, I think a key area here is really trying to flip some of our navigation and assessment tools on their side. So the systems policy issue was, let us do our best to be asset-based, strength-based, not deficit-based. That if we could begin or continue to address systems policy to be asset-based, that would advance the navigation piece considerably. So last but not least is our fifth area or opportunity area. And this is really to advocate and remove barriers and really develop our policy and system design work. So this is really some of the behind the scenes pieces that enable the good work in community. And perhaps no surprise to anyone that in the immediate opportunities column, they are funding is something that people identified as very important. So concern that we should begin to really have good conversation to address limitations of the current grant fund project funding model, that needed to change. and that we should also look at potential for new funding for grassroots community-driven activities. So new funding or increasing that funding. So funding was really identified as a critical area. When we looked at longer term opportunities, then we can see the human resource strategy was seen as quite important, looking at new service and funding models potentially, and cross-ministry work were identified as important. In terms of the systems policy work, I think the hope is over time we continue to move out of our silos and we undertake co-design work. So funders and service providers work collaboratively and collectively together to common purpose. And then I think, again, thinking of all the changes that potentially have occurred through what I've described to date, that we could mobilize this work to contribute to system design. So you'll see before you a fairly, I'm hoping people see it as reasonably robust. I think the way of organizing the action supports good conversation, and that we know there's a lot more activities and actions that could be developed related to these opportunities. In terms then, if we could move to the next slide, to move forward, I think again, we want to see that leadership could fall in several areas. It's no one group or organization's responsibility to undertake the action plan. Some organizations might have very particular roles and mandates that lend themselves well to the work. But again, we want to see key leaders take on some of these action areas, but also to work collaboratively together. And so in the work that was done as part of this project, you'll see in this slide the key leadership groups that were identified. And it's not to be a limited list, but these are the key groups that were identified in the project. So Healthy Aging Alberta, the government of Alberta in particular, key ministries within it. We do have, fortunately, in Alberta, a lot of leaders who are committed to systems change. So they were identified as our strategic contributors, but are not limited to that group. The Alberta Association of Gerontology, who was the catalyst for this work, and then acknowledging older adults themselves and individual organizations. So I'm just going to ask Marlene if she has a comment or two before we move to the polls and hopefully a bit of interaction amongst one another.
And you've done a really good job of bringing that report to life. And what's really important is the input that went into what Anne has reported and the excitement and the support for these recommendations from the Stakeholder Collaborative Committee. And that is a group, and that was in September, that represent the sectors, voluntary organizations, housing, citizens themselves, the ministries were there. So that is what we bring you. And I'm looking at this again, knowing that we now have a very large call to action from the Alberta government for changing the healthcare system. And the seniors ministry is a part of that because they are on the Integrative Council. And so there's a statement that says, we want to move forward in a different way. And one of the questions they're speaking to is local and increasing locally made decisions and connected services to improve outcomes. This work can be a contributor to that, but it will take again all of us working together with these new thoughts in mind, that North Star about well-being and that shared mental model that we will end with. But in between the North Star, the mental model is stuff we have to do, and we have to do it together. And that's the opportunity that we're asking about in the next poll.
So if I know we've given you a great a great deal of information at a very high level. And so what we thought might be interesting, I think hoping that today we might be starting conversation is to say when you think of these 5 areas and they're in front of you, these are the 5 areas or opportunities, strategic directions that are in the call to action developed through this project. We thought it would be interesting to ask you, where does your interest lie, and where might you want to do some work for impact? So we're going to set up a poll and just see what the result of that is.
Anne, actually, do you mind introducing the next slide? I just realized both poll questions are in the same poll, so we can do them at the same time.
Okay, not a problem. So this is the first one, looks at the 5 opportunity areas and says, where might you like to work for impact? The second one poll, it is only looking at the immediate opportunity for action. So that column that was on your left-hand side. And again, because we've presented this information so rapidly, we thought it might be interesting if we were going to do a future presentation or someone with the expertise, if it was a particular application you were interested in, that we might ask you, is there what opportunities are you most interested in learning about or advancing, so that we can begin to, again, see where people's interests lie. So that was Stephanie's voice you heard come from behind. And both these polls, as I understand it now, will appear together. And if you could respond to both questions, that would be great.
Yes, I'll just send it out now, folks, so you can just respond to these questions. And Anne.
Okay, so why don't we just look at these results? And this is very quick analysis, but perhaps it shouldn't surprise us that when we look at these 5 opportunity areas and where we might see common interest, we see that identify, integrate, and connect, align resources as very, very important. And I would say, as I already mentioned, I mean, we did ask the question, is this something we need to start, or is this something we need to, is already well underway? And I think one of the biggest challenges perhaps revealed by this work is how much good work is going on and how we really need to work together to share it and get it into people's hands. And then we can see that funding is very important to people. Those, if you'll remember, choice number 5, or our systems piece, had the funding and the HR component in it. It would come next. Navigation, and then the common language, and not that shared outcomes and isn't important. I think that's, but we can see that one maybe is the more specialized. That evaluation outcomes piece might not be where we're all centered, but I think quite important in being able to explain the importance of the work that you're doing in community. So I'm now going to move to the second one. And again, I think this is primarily for interest, to see where people's interest is. But again, very quickly, what I can see that connecting age friendly with healthier together is something that people see as quite important. Again, looking at the connection and work that's being done by Healthy Aging Alberta is quite important to people, or an interest.
Choice 10, 11, and 9 are also pretty high.
Yeah. Community exemplifiers, quite significant. Supporting work and recognizing caregivers. So a fairly even spread for, as I'm looking at this, but again, I think it does show where we might have some points for further conversation, and how these actions are executed in each community. It's more than likely going to look different, but if we can share our learning and keep going, that would be great. So this is very helpful to us, and we just wanted to get a signal if some of this work had resonance for you. So as Stephanie said, if there were particular questions, if you wanted to put them into the chat, we could respond to them first. And then if we have time, we would look potentially to putting everyone in a small group just so that you could have some opportunity to share that cross-sector collaborative work that you're undertaking, or to discuss an observation or reflection related to the project. But first, let's see if there are any questions that people have put in the chat.
We did have one earlier back here. So we have a question here. With the ongoing challenges of a shortage of resources in the public sector, has there been any consideration on how to integrate work with the private businesses that support older adults to address the growth we see in the coming years?
I might just comment, that's exactly the kind of community capacity that may end up becoming real when there's conversations in a community. And I think one of the things that's become really clear is that we can't plan it all from 30,000 square feet, and this is how it will be, but there's got to be, and there's some of this in this about changing the ability to move on the ground and to show things. And that's where that community enabler piece came. Maybe there's some good examples that are very instructive that we can learn from. So it becomes, some of the answers become organic from the ways things have happened, and then we'll see where they go. So that's a little bit of what we've tried to set in motion as opposed to define.
Then the next one was more of a comment as opposed to a question, but it was resonating with absolutely. Improving navigation is key. As a caregiver, I have to call 811 for health services and 211 for nonprofit services, and then check Google for business. So that was resonating with part of the presentation, and that sometimes it can be a devil of a time in quotes as a caregiver to learn what to do next. Okay, here's another one. I have a question about CDHC. How long does it take for a client to be approved for this program under AHS?
No, I myself would not know the answer to that question.
What is CDHC?
Do any of our attendees know the answer to that question?
Yeah, I could provide a little bit of clarity on that. My name is Carolyn Weir. I work in home living for Alberta Health Services. It's an invoicing type program that's offered for, yep, someone just, yeah, thank you, Shamshad, for a client-directed home care. It's a funding model that is being utilized to help create more flexibility for caregivers who are receiving care through home care. So on average, it is person dependent. There's different assessments that need to be taken, but I've seen it being, set up and ready to go within 2 to 3 weeks. Again, it's all client and caregiver dependent, with the different paperwork that needs to be looked at and the assessments that the case manager has to do. So I don't want to put a specific number to it, but there is a bit of a process on both sides, even for the family to then get the information to find the care providers that are listed through Blue Cross. They would have that piece to sort out as well. So that might be also included in the amount of time being able to have it implemented from start to finish, which is, having services up and running in the home. So hopefully I provided a little bit of clarity for Shamshad, who asked the question.
Carolyn, for your answer there. Okay, I think that's all we have for questions in the chat, unless anybody wants to ask anything live. And there was a question, kind of a statement in the chat. Yes, as a reminder, we are recording this now, and we will send out the video post event here for you. So if you
So what we'd like to do now, because I think really one of the things that might be a bit different about this um, project is that it really is iterative and dynamic. That the idea is that this call to action isn't static, that the project, because of the breadth of activity within community, couldn't possibly capture or articulate all that activity. So before we close off, we wanted to take about 10 minutes to put ourselves into small groups to either, if you want to share a reflection or comment about the project, great. But I think also just to share what's going on in your community. Are there some resources that you want to highlight within your small group? And that we could just give people that opportunity to keep building out, in essence, the call to action. So thanks to Stephanie's technical ability, we'll be able to go into small groups. They're just designed for informal conversation for about 10 minutes, and then we'll come back and close off the presentation. But thanks everyone for participating in those groups. I think our hope was that through this project, we continue to build out relationship and understanding of what is happening on the ground. So now I'm going to turn it over to Marlene for some final words and conclusions about the project.
Right. So we titled the lead page in our report, "Now is the Time." Now is the time. We have a vision for healthy aging and quality of life for older Albertans. Demographics and changing public expectations are with us. There's evidence of the importance of social determinants of health and reorienting to a person-centric, community-focused system. This initiative shows readiness to move and a path forward, and that was very interesting in the breakout group that I was in. Alberta is in a time of change. Remember, we wrote this before November. Now it's even more important that we take these for community-centric work to show what local decision-making, which is a big piece of the change expectations, can be, and Alberta can be a leader with a community-focused system and make the structural pieces that we are going to see work well. So that's now is the time. And we invite you to the last slide to take the picture that we've been kind of thinking about. People in the center, in the communities where you are, Beaumont or Sundre, getting to know who's there, determinants of health, that common language, that ecosystem of shared values and shared opportunities to connect, to create a community and structures and sustainability. And yes, policy change will have to happen to create that sustainability of well-being for older adults, mobilizing action together. And I want to share with you, this presentation will be on CORE. It will be on the AAG website as the recording. We also want to mention that in the report, it talks about exemplars. There are, if you look at the website for AAG awards, Vivian Lai Changemaker Awards, you may know a community that is taking on some of these changes and being an exemplar of pulling together, and we can learn from that. So maybe there's a community for a Vivian Lai Changemaker Awards. And so I leave you with that. I also leave you with the fact, if you go to the AAG website, you'll see an opportunity to register for a thought leadership forum around diversity, because inclusiveness for well-being and living well is, of course, underpinning all we see on this slide. Thank you for being here. Look forward to your contributions, everyone here today.
Thank you, everyone, for attending. And thank you, Anne and Marlene, for presenting here. I've put a survey in the chat, and we'll also send it via email as well to folks. As Marlene mentioned, we recorded the session, so we will post it up on Core Alberta on our Healthy Aging YouTube and AAG's YouTube after this, and we'll send you the link. And then if you have any post questions for us, you can email any of us at Healthy Aging Alberta at info at healthyagingalberta.ca. Yes, thank you.
So I think with that, we are adjourned. Again, I just echo Marlene's thanks for joining us, and the hope that this is the beginning and continuation of conversation about how to do community-based collaborative work in terms of integrating those sectors that we know sometimes are definitely siloed. So thank you all for participating.